The U.S. president's tariff threats leaving the BC government scrambling again today to respond, while its ministers were also under fire for the worsening state of the healthcare system back here at home. For more, let's check in with Rob Shaw at the BC legislature. So, Rob, there's a lot going on right now. How did this all play out today?
Well, Stacey, it's a perfect example of the dual reality that this NDP government is in, getting hit by crises both at home and abroad, all in the span of a few hours today. And let's start with Trump. As you heard in Mary's story, that March 4th tariff deadline means we will be sitting in the BC budget lockup with the finance minister delivering those figures at possibly the exact same moment the U.S. president is signing those tariff orders for 25% on Canadian goods in the Oval Office. That is expected to blow at least a $2.5 billion revenue hole in the provincial budget. Could not come at a worse time, because 2 years of overspending by this NDP government has racked up a structural deficit of $9.5 billion this year alone. So we're expecting a lot of red ink in that budget. On top of that, today, the Canadian Federation of Independent Businesses issuing a new report saying small business confidence in this province has fallen by the largest amount in Canada. Here's government's response to both those issues today.
It's still early in the morning, so things can change at least 4 or 5 times still, which makes it really difficult for us when we're trying to respond, quite frankly. The reality is regardless of when the tariffs come, whether they're next week, the next month, or they say they're not going to be coming in the short term, we have to prepare.
There's no question in that CFIB report that it's Trump's tariff threats that's undermining confidence today. It was on an upward trend, and now it's turned down. And we are working day in, day out beside business, listening to them and engaging with them to ensure we can respond to the Trump tariff threats.
At the same time today, opposition Conservative MLAs spending the entire 30-minute question period listing off hospital ER closures across most of British Columbia, in some cases up to 2 years. The tiny town of Elkford near Fernie in the East Kootenays, for example, stories of lengthy closures, people having to drive hours away in a crisis. A familiar story here on the island, where Saanich Peninsula Hospital's ER has been closed during evenings since July of 2023, and lots of North Island closures as well. Here's a taste of question period today.
Every part of this province has been represented today, speaking about the state of our healthcare. Can you imagine having your child, your ailing child, in the back of your car and having to drive 10 hours to access an emergency room department?
Mr. Speaker, we have canvassed many different communities across BC in today's question period. Mr. Speaker, I didn't hear any ideas from the opposition, but one idea I have heard is bringing in a U.S.-style two-tier healthcare system that would poach doctors and nurses from our system and make it worse.
Raucous question period, as always here. The health minister trying to make the argument that ER closures are down 40% in the last 6 months. A neat figure, not sure if it withstands the public scrutiny in the real world. An unenviable position for this government on the healthcare file, Stacey, and also on the tariff file, as there are many different controversies brewing here at the legislature in advance of a very difficult provincial budget on Tuesday.